U equals you. This is Miguel Gomez reporting live for HIV.gov from Munich, Germany. I have some colleagues and I'm going to ask some questions, important questions about U equals you. I'm going to start with one of my federal colleagues from the CDC, Monique. Right before the conference was an impressive workshop in which a toolkit was released. I want you to tell everyone about that toolkit, please.
Absolutely. Well, let's start with the importance of U equals you. Undetectable equals untransmittable is an important, not only is it a community-led health message, but it is a global campaign to communicate the important science behind the message that a person living with HIV who maintains an undetectable viral load on treatment has zero risk of transmitting HIV to their sexual partners. This life-saving message is important for not only everyone to know, but broader audiences, but specifically because it empowers those living with HIV. One of the most important things about the toolkit that was released is that U equals U is both PEPFAR and global fund required for its countries. But unfortunately, prior to the release of this resource guide, there was very little instruction on how to take this life-saving message and integrate it into HIV programs for both prevention and for treatment. So now, one of the things that we're most proud of at CDC is that we developed this resource guide in 6 parts with the global leading advocates at Prevention Access Campaign to honor our commitment for transformative community-led partnerships and make sure the U equals U message was accessible to everyone, not just our policymakers and our programs, but our community and our advocates to be able to spread this message. So this toolkit literally gives you step-by-step instruction on how to take this very important life-saving message and implement it. And it will not let you fail. It will walk you through activity by activity, from everything to how to develop your materials with community members, not apart from them, but also to capacitate our providers, our policymakers, and help them be aware and understand how they can use U equals U to reach their global HIV targets.
Well, wonderful. And I'm not going to wait to the end. I'm going to let my first question is follow up to you is where can people find it?
You can go. It is available. It was officially released online at CDC Global, Undetectable equals Untransmittable, and our first ever external facing page for U equals U, where you can download the resource guide, where it was officially released on Sunday, July 21st, in honor of No HIV Stigma Day. So we are so excited. You can go there, but importantly, not only can you download the guide, but you can stay tuned for updates on U equals U University and training opportunities and build our community.
Well, speaking of the university, I'm going to go to Deondre Moore, a PACHA member who has been staffing and presenting at the U equals U University booth in the Global Village. I would like you to share your experience in the Global Village, but also at 3 o'clock today, an amazing thing is happening to help extend the reach of the toolkit. Please share.
Yeah, so Miguel, thank you. And shout out to you, Monique, and the CDC Global for all that you're doing. This is life-saving, and I'm so excited that the United States is tapping into this and that we are becoming a part of this life-changing moment that we're seeing in history. This is going to go down on the timeline when folks look back at community and see what countries have signed on to this. And so this is all an historic day for the United States and the world all over. My experience today and this week has and engage with us with Prevention Access Campaign and our leaders to talk about U equals U University, as well as what U equals U messaging means for people. And what we're learning is that it's actually more than just sex, and it's more than science. U equals U provides mental health, a peace of mind to people. It provides freedom to people, and it allows people to take HIV, knowing that they can't pass it on and that the risk is actually zero. So it's been extremely inspiring, and I've got chills all day talking about this here.
You know, and for one who was lucky enough to stop by the booth a few times, the power of the message, both personally and individually, life-changing.
Yes.
So now I'm going to go to another PACHA member, but I'll have another question for you. Is, okay, Jesse Milan, you've been in the response for a very long time, which is a good thing, But
A
in
hero.
the United States, what does the U equal U message and now having an additional resource mean for the community?
Well, I'm a person living with HIV for a very long time, and I think this populations. For those of us who are living with HIV who are already in, it's a transformative message because it helps us understand that we are not vectors of disease. We can live a long and healthy life by becoming undetectable, but also means that we can't transmit this to anyone that we love or anyone we're having intimate relationships with. And that tells us that we can live just like everyone else. We can have a healthy marriage, a healthy partnership, a healthy relationship with our significant others, and that it can be a fulfilling sexual relationship as well. And if you're a woman, it means that you're not going to pass this on to your unborn child. That is huge. That is huge. And at this conference, I think that's a message we need to share with that population of people who already are in care. But there's a population of people who are not yet in care, who don't know their HIV status, and who are afraid because they won't be able to live a normal life. But that's who needs to hear this more than anyone, so that they understand that's why you need to know your HIV status, so you can get in care, so that you can live long and healthy like the two of us, and never pass this disease on. And the third population are clinicians, nurses, doctors. It's a message you need to tell your patients. Do not let them be in that room with you without them hearing that by taking our meds and getting undetectable, we will never pass this on. We don't hear that message from you, clinicians. We need to hear it from you. And we as a people living with HIV need to share it with each other.
Absolutely. And speaking of more individuals hearing the message, I'm going to end with you, sir, but I'm going to switch over to my federal colleague.
Yes, please. Yes.
You've worked hard to move this forward. As someone in the federal family, what does this mean as an additional tool to help us in our response?
Absolutely. So, as he so eloquently put, with our different audiences who need to hear the message, I think it's equally as important that us in the response actually know how to meaningfully not only understand and communicate the message, but amplify the voice to raise the message. And we are in those positions where we have decision making that happens within how we capacitate our providers, how we share information, and what we deem as important and as an important strategy. And I think that's what the importance of the toolkit is to give those people, our feds, the confidence to be able to understand and speak to that audience how this helps us reach our global targets, how this helps eliminate stigma and discrimination, how it promotes treatment access and health equity. So I think it's important to be able to communicate those things and be able to champion them effective and use our voice in that way.
And what I like, and respectfully, my words, it's a step-by-step guide for implementation and how to make it real in your program.
And it's free.
And it's free.
It is free.
Everybody knows free. That's amazing.
All right.
The work was already done.
Well, here, sir, I'm going to end with you. Some final comments for those who are watching.
Yeah, so I'm so excited today. Monique has set the tone for how we started off here at AIDS 2024. And today we get to celebrate even further the advances and the historic moments that are happening today at 3 o'clock here in Germany. The United States federal government, along with the Australian government, Canadian government, and the Vietnamese health ministries are going to be coming together again to celebrate the multinational call to action, otherwise known as MUCA, to celebrate U equals U, and federal governments or health ministries signing on to include U equals U in our guidelines and with our partners, and making it a requirement to continue educating our partners in our countries about U equals U. And I'm proud to say that the United States was the first country to sign on to this MUCA report in AIDS 2022 in Canada. So congratulations to us. Congratulations to all of the countries that will be there. And thank you to you two for being such great leaders and continuing sharing this message of U equals U to change lives every day.
And thank you for your leadership.
Thank you.
I also want to thank our viewers for following us from Munich, Germany, live for HIV.gov.